Non-Hodgkin lymphoma, NHL, is a type of blood cancer that originates in the lymphatic system, a crucial part of the immune system that includes lymph nodes, spleen, and other parts responsible for generating and storing cells that fight infections. Unlike Hodgkin lymphoma, which features Reed-Sternberg cells, a specific type of abnormal cell, NHL comprises over 60 subtypes, each varying in behavior, treatment response, and prognosis. The incidence of NHL has risen significantly over the past decades, making it one of the most common cancers in the United States, accounting for nearly 4% of all cancer cases. The good news is that with advancements in medical research and treatments, survival rates have improved considerably. Signs and symptoms. NHL symptoms can be nonspecific and vary depending on the subtype and location of the cancer, but common indicators include swollen lymph nodes, fever, night sweats, unintended weight loss, fatigue, and abdominal pain or swelling. Due to the general nature of these symptoms, they can easily be mistaken for other illnesses, which can delay diagnosis. Risk factors and causes. While the exact cause of NHL remains unknown, certain factors may increase the risk, including age, most common in people 60 and older, gender, more common in men, weakened immune system due to medical conditions or treatments, some infections, family history, and exposure to chemicals. Diagnosis and treatment. Diagnosis typically involves a combination of physical exams, blood tests, imaging scans, and a biopsy of the lymph nodes. Treatment options vary greatly depending on the stage and type of NHL, but can include chemotherapy, radiation therapy, targeted drug therapy, immunotherapy, or a combination of these. In certain cases, stem cell transplants may be considered. It is important for patients to have thorough discussions with their healthcare providers to understand their specific diagnosis and the potential benefits and risks of different treatment options. Regular monitoring and a comprehensive care plan play a critical role in the effective management of the disease. Non-Hodgkin lymphoma, NHL, is a type of cancer that originates in the lymphatic system, which is a part of the immune system responsible for fighting off infections and diseases. What makes NHL particularly concerning is its origin in an essential component of the body's defense mechanism, making the battle against it both internal and profound. Unlike Hodgkin lymphoma, NHL is characterized by the absence of Reed-Sternberg cells and comes in many different subtypes, each with its own unique behavior and response to treatment. NHL mainly affects lymphocytes, a type of white blood cell that plays a critical role in the body's immune response. These cells can grow uncontrollably, forming tumors in the lymph nodes, spleen, and other organs. It's a disease that doesn't discriminate by age, although certain subtypes can be more prevalent in younger or older populations. The American Cancer Society highlights that NHL accounts for about 4% of all cancer cases in the United States, underscoring its pervasiveness and the necessity for public awareness. Diagnosis typically involves a combination of physical examinations, blood tests, imaging, and biopsies. The staging, ranging from stage 1 to stage 4, indicates the extent to which the cancer has spread. Stage 3 typically involves cancer spreading to lymph node regions on both sides of the diaphragm, indicating a more advanced state of the illness. Treatment options vary based on the stage and subtype of NHL, and may include chemotherapy, immunotherapy, radiation therapy, targeted therapy, or a combination of these. Advances in medical research have introduced new therapies that offer hope, such as CAR T-cell therapy, where a patient's T-cells are genetically modified to fight cancer. It's critical for individuals diagnosed with NHL to work closely with their healthcare providers to determine the most effective treatment plan. While the diagnosis of NHL can be daunting, the continuous advancements in medical research and treatment strategies provide optimism for improved outcomes. Support from family, friends, and cancer support groups also plays a crucial role in managing the emotional and psychological impact of the disease. Non-Hodgkin lymphoma, NHL, is a type of cancer that originates in the lymphatic system, which is part of the body's immune system. The lymphatic system includes the lymph nodes, spleen, and other organs that produce and store cells that help fight infections and other diseases. NHL occurs when these lymphocytes, a type of white blood cell, grow and multiply uncontrollably. One of the distinctive features of non-Hodgkin lymphoma is its variation. It encompasses a wide range of subtypes, over more than 60, each with its own behavior, treatment options, and prognosis. These can be grouped broadly into B-cell lymphomas, which make up about 85% of NHL cases, and T-cell lymphomas. Characteristics of NHL can vary significantly. For example, some forms are indolent, meaning they grow slowly and may not cause symptoms for months or years. Others are aggressive and can spread quickly, requiring prompt treatment. Symptoms of NHL can include swollen lymph nodes, fever, night sweats, weight loss, and fatigue. However, because these symptoms are quite common and can be mistaken for other illnesses, diagnosis can sometimes be delayed, which emphasizes the importance of medical evaluation for persistent symptoms. Diagnosis typically involves a combination of physical examination, imaging tests such as CT or PET scans, blood tests, and a biopsy of the lymphatic tissue. Once diagnosed, the stage of cancer is determined, which helps guide treatment decisions. The stage of lymphoma, like Dave Coulier's stage 3 diagnosis, indicates that the cancer is found in lymph node areas on both sides of the diaphragm, or in lymph nodes above the diaphragm, and in the spleen. Treatment options depend on several factors, including the type and stage of the lymphoma, but can include chemotherapy, radiation therapy, targeted therapy, and in some cases, a stem cell transplant. While the diagnosis of stage 3 non-Hodgkin lymphoma presents challenges, advances in treatment have improved outcomes significantly. It's essential for patients and their families to discuss with healthcare providers to understand the best treatment approach and prognosis.